Hi, everybody. Dr. Balaze here. I'm going to talk with you today about the cost of implants. Why are they expensive? What do you get for your money? And what are some of the considerations that we make as dentists when we're planning these for our patients? So I'm excited to talk with you about this. Let's get going. Okay. So here we are. How much do implants cost? This is a great question, and we get asked it a lot. One of the first considerations we have is, where is this implant being placed? We are here in Laguna Niguel, California. It's going to be different here than if you're in Cleveland, Ohio, Detroit, Michigan, Atlanta, or in a rural community if you're not inside a city. So never mind other countries, Mexico, Canada. So that's going to be a big factor in what an implant costs, is where you are in the world where you're getting this placed. Secondly, is where in the mouth is it being placed? Is it the front tooth? Is it the smile zone? Is it going to be an implant that goes into your zygoma, your cheekbones, to support a denture? So where in the mouth is going to be a big factor of it. Why? Why are we placing the implant? What's the reason? Is it to replace a tooth? Is it to replace multiple teeth? Are we going to be using it to hold on to a denture, or maybe even use it to help with some orthodontics? So there's lots of reasons that we use implants for, and depending on the case and the location, that's going to influence the cost a lot. My third question is, what was there before? Why is the tooth been missing for a really long time? Is there a history of infection in the site? Is there a tooth there that's cracked and maybe we can't use, it's unrestorable, has to be extracted? Those are all factors that influence the cost as well. Fourth, what type of implant are we placing? Is it going to be titanium? Is it going to be a ceramic implant? Those have different factors. The titanium have been around for a very long time, but recently we're having really good success using ceramic implants. Alongside of that question, along with that comes the brand of the implant. What is the manufacturer of the implant? We use a lot of Nobel and Straumann. In Cleveland, I used a lot of Zimmer. Dentsply is another major manufacturer. These are companies that have been around for a really long time and have a great history, tons of research, and there's lots of parts that are available. There's many others that are sort of in the implant game, different companies. Some are brand new, some are not. Some are available in the United States, others only in Europe. So the type of implant influences the cost as well. My next question is, who's placing the implant? Is it a general dentist? Is it a periodontist or a surgeon or a prosthodontist? That is going to influence the outcome. That's going to influence the cost. And that's very important to consider. Who's actually in charge of the surgery? And then who's receiving the implant? Tell me about the patient. If it's you, your age, your health comes in what medications you're taking. Do you have dry mouth? Do you have diabetes? These are all complications. Osteoporosis is another big one, obviously. So these are all considerations that are going to complicate the surgery for placing the implant. Lastly, who's restoring it? Is it the same person here up in number 6? Is the general dentist placing the implant, or the prosthodontist placing the implant and putting the restoration on it, whether it be a bridge or a crown or a denture? Or is it a team? So the surgeon places it, and then your general dentist or your prosthodontist is restoring it. So those are all really big considerations. The other big thing is what type of a restoration is going on it. I didn't include that in my list here, but big question: what is going on top of the implant? Is it a crown? Is it require an abutment? Are we doing a customized abutment for you? Is it a bridge? Those are all going to influence both the cost and the success of the implant. So these are all things that we think about, and they're individual. Not one implant is the same. I can't tell you in my practice exactly just by over the phone, tell you what an implant is going to cost for you until we get a really good idea of the person that's receiving the implant and an overall plan of what the final outcome is going to be. So I hope we're right at about 5 or 6 minutes here. So I hope this video is helpful, and I hope it answers your questions. We're happy to provide you with a second opinion if you need one, and you can give us a call, and we'll look forward to meeting you soon. Thanks so much. Hope you enjoyed it. Make sure to like, comment, subscribe, and we'll definitely be doing more of these in the future. Thank you so much.